cardiac cycle consists of 7 phases: atrial systole, isovolumetric ventricular contraction, rapid ventricular ejection, reduced ventricular ejection, isovolumetric ventricular relaxation, rapid ventricular fill-in, and reduced ventricular fill-in. In the graph form, every phase is separated by the dashed vertical lines. During the cardiac cycle, we will examine changes of aortic pressure, left atrial pressure, left ventricular pressure, heart sounds, and left ventricular volume. The ECG can be used as a time event maker. The cycle begins with depolarization and contraction of the atria, or phase A, atrial systole. It is preceded by the P wave on the ECG, which marks depolarization of the atria. Contraction of the left atrium causes an increase in left atrial pressure. The left ventricle is relaxed during this phase, and because the mitral valve is open, the ventricle is filling with blood from the atrium even prior to atrial systole. Atrial systole causes a further increase in ventricular volume, as blood is actively ejected from the left atrium to the left ventricle through the open mitral valve. The corresponding blip in left ventricular pressure reflects this additional volume added to the ventricle from the atrial systole. Atrial systole causes a forced harsh sound. Normally it is not audible in adults. In this period, aortic pressure falls because the blood that was ejected in previous cycle is running off in systemic circulation. Phase B, isovolumetric ventricular contraction. Isovolumetric ventricular contraction begins during the QRS complex, which represents the electrical activation of the ventricles. When the left ventricle contracts, left ventricular pressure begins to increase. As soon as left ventricular pressure exceeds left atrial pressure, the mitral valve closes. In the right heart, the tricuspid valve closes. Closure of the atrioventricular valves produces the first heart sound. Aortic pressure continues to fall because the blood from the previous cycle is going to systemic circulation. Ventricular pressure increases dramatically during this phase, but ventricular volume remains constant because all valves are closed. This is the way why this phase called isovolumetric ventricular contraction, because ventricular volume doesn't change. Phase C, rapid ventricular ejection. The ventricle continues to contract, and ventricular pressure reaches its highest value. When ventricular pressure becomes greater than aortic pressure, the aortic valve opens. Now blood is rapidly ejected from the left ventricle into the aorta through the open aortic valve, driven by the pressure gradient between the left ventricle and the aorta. The most of the stroke volume is ejected during rapid ventricular ejection, dramatically decreasing the ventricular volume. Concomitantly, aortic pressure increases as a result of the large volume of blood that is suddenly added to the aorta. During this phase, atrial filling begins, and left atrial pressure slowly increases as blood is returned to the left heart from the pulmonary circulation. This blood will be ejected from the left heart in the next cycle. There are no heart sounds in this phase. The end of this phase coincides with the end of ST segment or the beginning of T wave on the ECG. Phase D, reduced ventricular ejection. During reduced ventricular ejection, the ventricle begins to repolarize, which is marked by beginning of T wave on the ECG. Ventricular pressure falls because the ventricles are no longer contracting. Because the aortic valve is still open, blood continues to be ejected from the left ventricle into the aorta, but at a reduced rate. Even though the blood continues to be added to the aorta from the left ventricle, blood is running off into the arterial tree at even faster rate, causing aortic pressure to fall. Ventricular volume also continues to fall, but at a reduced rate. Left atrial pressure continues to increase as blood returns to the left heart from the lungs. There are no heart sounds at this phase. The next phase is isovolumetric ventricular relaxation. Isovolumetric ventricular relaxation begins after the ventricles are fully repolarized. and marked by the end of T wave on the ECG. Because the left ventricle is relaxed, left ventricular pressure decreases dramatically. When ventricular pressure falls below the aortic pressure, the aortic valve closes. At the point where the aortic valve closes, the aortic pressure curve shows blip, called dicrotic notch, or incisura. The aortic valve closes slightly before the pulmonic valve, both producing the second heart sound. Because all valves are closed again, no blood can be ejected from the left ventricle, nor can be left ventricle filled with blood from the atria. Therefore, during this phase, ventricular volume is constant, or phase is isovolumetric. Left atrial pressure still rising due to return of the blood from the pulmonary circulation. The next one is rapid ventricular filling. On ECG, this period represented by part of TP segment. When ventricular pressure falls to its lowest level and slightly below the left atrial pressure, the mitral valve opens. Once the mitral valve opens, the left ventricle begins to fill with the blood from the left atrium, and ventricular volume increases rapidly. Ventricular pressure remains low, however, because the ventricle is still relaxed and compliant. Due to filling of ventricle by blood from the atria, left atrial pressure decreases. The rapid flow of blood from the atria to the ventricles produces the third heart sound, which is normal in children but is not heard in normal adults. During this phase, aortic pressure decreases as blood runs off from the aorta into the arterial tree. The last phase of cardiac cycle is reduced ventricular filling or diastasis. On the ECG is represented by end of TP segment and first part of P wave. Ventricular volume continues to rise. Ventricular and atrial pressure starts to increase. Aortic pressure decreases because ejected blood goes further in circulation tree, and there are no heart sound in this phase. This stage is the longest phase of cardiac cycle. If you like the content, press like, subscribe to our YouTube and Telegram channels, and have a good day.
Here we go.